Hi, good day. Today we're going to talk about varicose veins. I mean, it's such a common condition that I just had to talk about it. So, varicose veins affects about 5% of the world's population, which might not seem like a lot, but it really is. And it's more common than you would think. Now, varicose veins, risk factors can be genetics, height, weight. There's even like I mentioned, the genetic component of it. You can have certain genes such as the FOXC2 gene, which is associated with an increased likelihood of getting varicose veins. You also have pregnancy. That's another very common cause of varicose veins. And also if you have a history of deep vein thrombosis, or what we call clots in the leg. First, I must mention or talk about veins, especially in the lower limbs. Varicose veins are very common, or most commonly found in the lower limbs. Now, when you have varicose veins in the lower limbs, it usually affects the superficial, meaning those that are closest to the skin. Hence is why most times you can see that a person has varicose veins. Some might be more prominent than others, but for the most part, most middle-aged people that you will see, if they have varicose veins, you can see them. Now, varicose veins occur as a result of incompetence in the valves found in these veins. Now, veins have these valves, just picture pipes that have a valve in them that prevents the backflow of blood towards the feet. So when you're walking, blood is pumped from your veins back to the right side of the heart. These veins, because of how they were designed, the valves in the veins prevent the backflow of blood back down into the feet. Now, when these valves fail, there is the light is messing up. When these valves fail, there is a buildup of blood back into the lower limbs. So blood pools in these areas. And when blood pools in the lower limbs, the veins can bulge as a result of this pooling of blood. And when the blood pools in these veins, they bulge. Sorry, 1 second. I just want to make sure that this video the lighting doesn't flicker. Okay. Hope that stops it. Okay. So when the blood pools in these veins, as I mentioned, you get this sensation or this visual change in these veins. And that's where the trouble starts. Now, as I mentioned before, age, height, weight, your job, family history, these are just some of the issues that can occur. If you have certain syndromes, such as Kippel-Kalani or Tenani syndrome, this can result in you having an increased likelihood of developing varicose veins. Now, varicose veins are diagnosed via the use of Doppler ultrasounds most times in our setting, but ideally it should be a venous duplex. Now in the UK they use venous duplex, but most of us in the Caribbean, if you've had varicose veins, you've been sent for a Doppler ultrasound instead of a venous duplex. Back in the day we used to use tourniquet tests, or they used to use tourniquet tests, but they don't use that much more. Right now you can use venography as well to diagnose if you have varicose veins. Now, varicose veins can come with a whole host of complications. For one, they can rupture, they can darken the skin around the area, and they can result in, the main issue that people have is that they're not very pleasant to look at. But darkening of the skin, changes in swelling of the lower limbs, you can have issues with ulcer formation if you end up with something called chronic venous insufficiency. These are just to name a few. So a lot of people who have varicose veins or so-called poor circulation will end up with what we call varicose ulcers or ulcers. These ulcers can occur very close to the ankle, but a lot of the times they fester. So people have ulcers for years. We're talking 1, 2, 3 years. Ulcers that do not heal because of the poor circulation to the area. Now, these ulcers, when you go to the doctor and you have ulcers, most times you get them dressed. And people will say, okay, doc, can you prescribe me antibiotics? But antibiotics do not cure ulcers. Let me just say that straight off. It does not cure ulcers. So because you're going to the doctor gives you antibiotics each time because you have an ulcer does not mean that it's going to heal. Ulcers can be healed. Most times you would need to involve treatment. The expertise of a plastic surgeon will offer you quite a whole host of different treatments. Sometimes they may even offer you a graft to cover the ulcers to help it heal, or to just help it to be covered, because once it's open, bacteria and all sorts of pathogens can get into it and result in poor healing of this ulcer. So one of the things that the plastic surgeon does is offer you a skin graft, and this skin graft will cover the area. He moves flesh from one area of the body to another area, and this covers the ulcer. And a lot of the times you get success in terms of healing of these ulcers. But this whole concept of antibiotics and ulcers, it's a farce. Don't believe for a second that because of you're on antibiotics for a whole month, 2 months, that your ulcer is going to heal. It will not. So I've covered risk factors. I've covered the anatomy. I've also covered complications. Bleeding, as I mentioned, ulcer formation, and aesthetically they're not pleasing to look at. Now let's talk about treatment. Treatment of varicose veins. Varicose veins can be treated by a whole host of different modalities. First, we can start with the conservative treatment, which is compression stockings. Compression stockings are usually advised to be worn below the knee. And what these compression stockings are graded, meaning that they offer different pressures at different areas. So at the ankle, it would offer about 30 millimoles of mercury of pressure at the ankle, but at the calf or just underneath the knee, it would offer about 15 millimoles of mercury of pressure. And what this does is that it helps to pump blood from the ankle, which is pooling, right back up the leg and by way towards the right side of the heart. So that's what is the real purpose of compression stockings, which is to prevent pooling of blood. Other therapies would be sclerotherapy. Now, sclerotherapy involves injecting a compound composed of sulfate and a few other, I can't remember the actual compound's name, but it's injected blindly into the varicose veins, and what it does is it causes fibrotic changes in the vessels, and this results in the vessels actually not looking as aesthetically unpleasing. There's another treatment such as foam therapy. Foam therapy is another way in which they use, once again, it's injected or placed into the veins, and it results in a similar effect. And then the final surgical intervention, which is venous stripping. So what they do is they actually remove the damaged valves and create a pathway that will allow less pressure buildup or less pooling of blood in the veins in the legs. One of the biggest issues with these procedures is that there's a chance of recurrence. Now, I don't want you to think that the moment you get the surgery that it's automatically curative. There's a chance of recurrence with all of these modalities. So that's something that you have to keep in the back of your mind. So let's continue even further into issues that can occur. Now, as I mentioned before, you can have swelling if you, for instance, end up with complications of varicose veins. So you can have swelling of your ankles if you stand up too long. And we have gravity-dependent swelling. So for instance, you will notice that when you go home and you sit down and you put your legs up, the swelling will actually go down. So the swelling will go down when you put your legs up. If you stand for a long period of time, the swelling will be there. So what this says is that you have to, one, get diagnosed early, get interventions done as early as possible. In the Caribbean, a lot of the times we prescribe Daflon. It works for some, but it doesn't work for all. Daflon is usually 500 milligrams twice daily. But compression stockings, I know they work. I know I've seen them work. And I've seen surgery work as well too. One of the complications that can occur with, one of the issues that can occur, hi, good day, Pamela. One of the issues that can occur, for instance, with chronic venous, that can develop is chronic venous insufficiency. Chronic venous insufficiency means that there's an issue with the circulation of blood in the area as a result of the incompetence of the valves. Sometimes you can have this as a result of if you had a clot in the leg at some point in time. So for instance, if you had deep vein thrombosis or clot in your leg, which usually occurs in the calf, it can damage the vessels around, resulting in chronic venous insufficiency. So what this will do is cause darkening of the skin around the ankle and spread right up to maybe even mid-calf. I've even seen it as far up as to just below the knee. This darkening is called lipodermatosclerosis. Lipodermatosclerosis is a condition that occurs as a result of this pooling of blood. It's as a result of some of the components in blood called hemosiderin, which causes a darkening of the skin. One of the worst things that can happen as a result of this chronic venous insufficiency is ulcer formation. Ulcer formation, as I mentioned just now, ulcers take forever to heal. And you just see people walking around with bandages on their ankle and they've had these ulcers for a long time. Sometimes the ulcers get infected, they have an odor, they take long to heal. But did you also know that there's something called Marjolins ulcers, which is as a result, hi, good afternoon, Winsome. As a result of these having a chronic ulcer, there is an increased risk of developing something called Marjolins ulcers, which are cancerous or squamous cell carcinoma developing in and around the ankle. Now, when this happens, you may actually need the intervention of a surgeon, because Marjolins ulcers means that you have cancer within that wound, and it can occur and has occurred quite a few times. Sorry, let me move this around. It has occurred quite a few times, and as a result of this, ulcers do predispose you. Oh, that made the lighting even worse. Sorry. Ulcers do predispose you to cancer. I'm sorry to say, but you can have the development of cancer in chronic, long-standing ulcers. It's called Marjolins ulcers. So it's actually a form of squamous cell carcinoma or squamous cell cancer, and it can be destructive and potentially even fatal if untreated. Now, what can you do to reduce your risk of developing varicose veins, chronic venous insufficiency, and deep vein thrombosis, which is a precursor or risk factor for chronic venous insufficiency? Now, I have to tie this back into weight loss and being active. Now, varicose veins, one of the risk factors is obesity, being overweight. A lot of people who are overweight have varicose veins. A lot of people who are obese, morbidly obese, or super morbidly obese are sedentary as well too. So being overweight predisposes you or puts you at risk for developing varicose veins. Being sedentary, sitting down a lot, also predisposes you to developing deep vein thrombosis. There's a triad of symptoms called Virchow's triad, which includes stasis, hypercoagulability, meaning or thick blood, as it were. So stasis, thick blood, and I forget what the last one is, but sitting down, being sedentary, not circulating the blood in the body, predisposes you to developing clots. If you develop clots, you're at increased risk of what we call pulmonary embolism, cerebrovascular accidents, and if you have a cut in your leg, you're at increased risk of developing post-thrombotic complications as a result of developing clots, which is that you can develop poor circulation as a result of the clot being in your leg. So you can end up with this darkening of the skin around the leg, ulcers, swelling of the leg. Sometimes the leg looks like a reverse champagne bottle, so the calf is so big, but the ankle is so small, and around the ankle is so dark. You can have darkening of the toes, darkening of the feet as a result of this condition. So what can you do? Get up, get active. That's what you have to do. When you're at your desk all day, don't sit down all day. Walk around a bit. Make sure you get up. If you're sitting down for half an hour, get up and walk around for like a 10, 15 minutes. But if you sit down for the entire 8 hours of the day, that is not healthy. So you have to try your best to be as active as you possibly can. Work your calves. Do calf raises. Do reverse calf raises or lifting of the toes up as well too, to help with flexion, exercising the tibialis muscle, which is these muscles on the front end of your leg. Squats. Run, lift weights, eat healthy. People who eat less vegetables, who are eating processed foods and fast foods regularly, also, you need to change that right now. Are there any questions for those who have signed on as it pertains to varicose veins? I've covered treatment. Yeah, so I've covered most of the treatment for varicose veins. We use Daflon a lot in the Caribbean for oral medication as it pertains to the treatment of varicose veins. I'm not really going to say they do work and don't work. I would say it's like 50-50. Some people it works for, some people it doesn't work. What I would say to you is to make sure that you don't develop them or reduce your risk of developing varicose veins by being active. Activity is the best thing you can do. Being active. I also want to touch on today issues with arterial. So what we just talked about was veins, but you can also have issues with your arteries as a result of smoking, high cholesterol, family history as well. But those two, hypertension can cause poor circulation, diabetes can cause poor circulation as well in the lower limbs. And people sometimes have issues with walking long distances and they end up with something called claudication. Claudication is as a result of poor circulation to the lower limbs. When they have claudication, sometimes you'll see a person walk maybe 100 meters, then they have to stop, catch their breath, the pain wears off, then they start walking again. You can reduce your likelihood of developing poor circulation in your lower limbs by eliminating the risk factors: diabetes, hypertension, smoking, high cholesterol or high fatty meals, exercising, high vegetables, high fiber diets, just to name a few. Claudication, pain, or what we call, there's something that can actually progress. It can progress to something called rest pain. Now, rest pain is when a person is just sitting down and I've heard them describe it as pepper in their foot. Feels like their leg is on fire. And that's as a result of poor circulation. So people that have rest pain and they can't sleep, for weeks they can't sleep to the point that they present to the accident to the emergency hospital. We usually do a test, and when we do the test, it's shown that the person's leg is infected. Not infected, is poor, there's poor circulation to the leg. And the only relief we can offer after painkillers, because most times they're unable to walk, so most times just to offer them relief, they may even offer them, if they end up with a cut or anything on the leg, it can become infected, it can become gangrenous, and then afterwards the only option for us is to amputate. So if you're a smoker, stop smoking. As I mentioned, all the factors I just mentioned, you have to err on the side of caution when ingesting large amounts of fatty foods, large amounts of sugary processed foods. You have to change your lifestyle. Claudication, rest pain and claudication pain. Claudication pain is pretty bad, but rest pain, I've seen people, like I said, they describe it as their foot is on fire. They are unable to sleep. They are on the ward. And when they're on the ward, they cannot sleep. They're just there hitting their leg, hoping that they will get some relief. I just would not want that for not even my worst enemy. That's not a pain that I would want to experience. There's also something called Leriche syndrome. Leriche syndrome occurs it's very common in smokers. And it's a combination of butt claudication and they also have impotence. Those two are one of the main symptoms that people with Leriche syndrome will present. And it occurs in smokers. What happens is that the blood vessels become blocked as a result of smoking, which causes an increase in cholesterol deposition in the vessels that supply those areas. So people that end up with this syndrome, there's not much we can do. There is treatment in the form of AV grafts, or you can do what we call shunting of blood, where you place these materials called PFTE into the lower limb to bypass blockages in the arteries. But if you continue smoking, continue not being active, how successful would these procedures be? It's polytetrafluoroethylene. Yeah, so PTFE. I hope this was educational to you. If you have any questions, please ask. And any questions? Anything you want clarity on? I've touched on varicose veins. I've touched a bit on arterial issues that can occur. And have I left out anything? I think I've covered most of everything. Any questions? No. All right. Well, thanks for joining. And no questions. And if you, as I mentioned before, if you want to lose weight, you just WhatsApp message me at 876-339-3487. Continue to like and follow my page. Thanks for the support. And I look forward to future lives. I'm going to go live on Facebook just now to take a question and answer, so you can follow me there.